Just cover a little bit of background information and set up some questions so that Dr. Wong can talk about what we've been working on in the lab, which is working towards immunotherapies. And one of the areas that people have been talking about forever are cancer vaccines and what is their potential for mesothelioma.
Particularly looking at the comparison of 3D conformal techniques and comparing those patients and how they did compared to the patient who recently had tomotherapy. A lot of stuff I think people have gone through, and in the interest of time, I can go through them pretty fast. I have no disclosure.
Thank you very much for inviting me here. It is a challenge to talk about systemic therapy in mesothelioma. We don't have that many options, but we will try to go through the latest things that are available, and specifically we will go through the immune therapy.
But also we know in patients, if you can't get a 95% debulking, like a half debulking like this is actually worse than not operating. And I think it's because of, the immune system suppressed, and cancer loves all those factors that are coming in to heal the surgery. So that was our hypothesis anyways.
So I was telling a few of my colleagues yesterday, some of my referring colleagues, that I was going to come out and talk about the flavors of radiation, and they kind of rolled their eyes and they said, that doesn't sound very exciting. So hopefully this conversation that I have with you is actually going to be inspiring and hot, because I do think that radiation therapy has some really exciting things that we can kind of talk about.
I was in the pioneering time of lung transplantation. I was at Washington University, worked with Joel Cooper. Your title is Transition from EPP to Pleurectomy, Decortication, One Surgeon's Experience. In fact, it should be more, what did I learn in the past 15 years, me and my entire group, because it's not a surgeon. What is absolutely correct, when I started and went into mesothelioma research and treatment, we had still this belief that the disease of mesothelioma is unaffected by current therapeutic maneuvers. This was stated in 1988, but even in the year 2000, this was a kind of the opinion. And I thought this was unacceptable, and started a program in 2000, which was neoadjuvant chemotherapy, followed by EPP and variably radiotherapy.
Certainly very exciting times for the field of cancer immunotherapy, with the recent arrival of an entirely new class of cancer drugs called PD-1 immune checkpoint blockers, which we heard a little bit about this morning. A lot of press coverage on these new drugs that have just hit the market because many people, including myself, believe that we are potentially witnessing a paradigm shift in the way that cancer is treated. But now that the FDA has approved PD-1 blockers for treating melanoma and lung cancer, this has catalyzed the launch of numerous clinical trials testing their effectiveness in a wide variety of cancer types. Currently, there are at least 150 clinical trials testing either nivolumab or pembrolizumab for at least 30 different cancer types. At least 2 of those trials include pleural mesothelioma.
Good afternoon, everybody. In the next 15 minutes, I'll be talking about mesothelioma and the internet, big business, confusion, and desperation. On average, there are about 3,000 cases of mesothelioma each year in the US, but when compared to lung, breast, colon, and prostate cancer and others, mesothelioma is rare, making up only about 0.18% of all cancers. So why am I calling mesothelioma such a big business? Well, don't underestimate the importance of this rare cancer. Because of the legal implications of this disease, the 3,000 cases annually may be worth millions of dollars or more.
I want to talk about the human cost of inaction, because I think after an afternoon of hearing about all these wonderful clinical trials and what's happening in the medical field, it's also important to know some of the things that aren't spoken about, not necessarily in this room, but when you read articles and you look at studies to see what is exactly going on behind the curtain. Most importantly, though, before I begin, I always dedicate every keynote presentation to a victim, but today is different. I'm going to dedicate it to 3 victims who paid the ultimate price for a hug from a parent. It was a deadly hug. Michael on the top left lost his battle at 29, Janelle on the right at 39, and Debbie at 54. Again, staggering. And as Dr. Irving Zalikoff said it best, statistics are people with the tears wiped away. And for all of the doctors who treat the patients, and all of you here today, you know exactly what that means.
So curtains were made of flammable material, and in the old days they would have candles actually in front of the stage, and you can imagine sometimes the curtains went up in fire. And then when they discovered how wonderfully fire retardant asbestos was, Johns Manville, who were the largest producers of asbestos products, came up with the asbestos curtain. That asbestos curtain was sent to all the theaters around the United States, and very often it had the word asbestos in the middle of the curtain, and that gave the audience a sort of sense of security. Johns Manville, they manufactured roofing insulation, cement, and products for Navy vessels. Thousands of people sued them for claiming that they got sick from using their products, and they had to pay millions out and went bankrupt.
So the last trip to the doctor to get a scan revealed that the meso had taken over his lung and was fast moving into his abdomen. And he had 3 weeks to live. He was rushed to the nearby hospital, and I had the daunting task of setting up home hospice, or he would just leave us all 6 days later. That was on a Wednesday at 2:30 p.m., and by 4:30 p.m., Ed's passing hit every media porthole and global outlet. The outpour of compassion was wonderfully overwhelming. I look back now and I see that valuable time was wasted because of misinformation and 0 references. Had we had knowledge of PMC, it would not have been so horrific. I understand the role of a witness at the end of life is never easy, but the insights that you gain to human nature and your own life are immeasurable. Having had known of Dr. Cameron and PMC, it would have been comforting to know that there really is someone out there that wants to help.
We try to get people to address a lot of different issues in this disease, and again, this is a very small orphan disease, and we're trying to rush a lot of things through in a small period of time, but we really appreciate everybody coming out to support this. Thanks to all the speakers, particularly the ones that came from a distance, and of course thanks to our sponsors. It's without the sponsors, we would not be able to have this. As you see, the food and everything that's available in the room and everything costs way more than the registration fees even cover. So we owe everything to our sponsors, and thank you for our special guests, Mia Lauder and Linda Reinstein, for making this a very special day. Any other comments or questions? Otherwise, we'll see you next year. Thank you.